Welcome to HealthCast, the heartbeat of health IT. I'm Alexander Bolova, production lead at GovCIO Media and Research. With me today is staff writer researcher Nikki Henderson. Hi, Nikki.
Hi there, Alex.
You had the opportunity to chat with Lisa Lewis-Person, Deputy National Coordinator for Operations, Chief Operating Officer at ONC. How'd it go?
It went well, Alex. Lisa and I had an amazing conversation. She was so excited about the initiatives that are underway at ONC to advance health equity. Lisa also highlighted a couple of the programs that she sponsors that are designed to make sure that the agency's workforce represents all Americans by boosting the number of minorities who have careers in healthcare. So we really had a great talk.
Yeah, I'm excited to take a listen to your conversation. So, as you mentioned, Lisa sponsors many of ONC's diversity efforts, including the Diversity, Equity, Inclusion, and Accessibility Council. How did she say the council was helping when it comes to increasing minority involvement in healthcare?
Well, Lisa started the Diversity, Equity, Inclusion, and Accessibility Council 4 years ago. And she said the council was created to develop policies and programs that would impact all populations, not just certain ones, as she said. And Lisa said the council has been very instrumental in bringing a group of diverse voices to the table, like actively bringing different voices to the table, which is allowing them opportunities to become better, she said, in every aspect of the agency.
Lisa also helped to establish the Public Health Informatics and Technology Workforce Program. Can you tell me a little bit more about that program's overall mission?
Yes, she calls it the FIT program. That's the word that they use to describe it because it is a mouthful. But she said the FIT program was established with 3 goals in mind. She said that it was designed to enhance data collection, strengthen the public health infrastructure, and also to boost representation of those impacted by public health policies, especially those in the underserved community. So Lisa said the program is really helping so many people who would not otherwise be able to get certifications, bachelor's and master's degrees in public health.
It's really great to hear about how all of these programs are benefiting the community, and I'm really excited to hear the full conversation. But before we get into that, did Lisa talk about any future health IT initiatives at ONC?
Yes, she did. Like I mentioned earlier, she was really excited to talk to me, especially about the ONC's Health Equity by Design, which she said focuses on culturally competent care. She talks about how this framework begins and ends with the patient being top of mind. The core of Health Equity by Design is centered around the design of policies, the design of programs, the design of technology for a diverse group of patients that will result in healthy outcomes for everyone.
Well, it sounds like Lisa Lewis-Person is doing a lot of tremendous work at ONC, and I'm excited to take a listen to your all's conversation. So let's not keep our audience waiting. Let's dive in.
Today, Lisa Lewis-Person, the Deputy National Coordinator for Operations and the Chief Operating Officer at the Office of the National Coordinator for Health Information Technology, will be speaking with me about ONC's diversity efforts and how it's advancing health equity, as well as talking about the agency's Public Health Informatics and Technology Workforce Program. Hi there, Lisa. Thanks so much for joining me on HealthCast.
Thank you so much for having me, Nikki. It's a pleasure.
So before we get started, Lisa, can you please introduce yourself and briefly describe your role at ONC?
Absolutely. I am Lisa Lewis-Person. As you stated, I'm the Chief Operating Officer and the Deputy National Coordinator for Operations at ONC. For those who are not familiar with ONC, we are at the forefront of the administration's health IT efforts, and we serve as a resource to the entire health system to support the adoption of health information across all of the healthcare sector, and we promote the access, exchange, and use of health IT.
Okay, wonderful. Well, let's go ahead and jump into our conversation. Well, Lisa, I know that you sponsor many of ONC's diversity efforts, including a Diversity, Equity, Inclusion, and Accessibility Council. Can you tell me more about the council, when it was created, and how is it helping increase minority involvement in healthcare?
Absolutely. We started the diversity, equity, inclusion, and accessibility. And also now we've added belonging council in 2020. And we started it because we want to ensure that we have representation of all of America as part of the ONC workforce. I'm a firm believer that you cannot have equity without representation. And so we strive to ensure that when we're developing programs and policies in ONC, that impact the entire nation. We want to make sure we have diverse voices at the table, that we have diverse experiences, perspectives, challenges, and opportunities to become better. And so we created this as an employee-led committee and council, and it continues to grow. We have over 20 members of our council right now, and they carry out a number of activities internally for ONC.
That's great to hear. Well, what role is the DEIA Council playing when it comes to advancing health equity?
As far as health equity, we have a representative group of our employees who make sure that all of ONC is aware of the different areas in which we work, such as our health equity by design work, our FIT program, our recruitment efforts. They ensure that we have cultural events on a regular basis just to make sure that we are aware of everything that's happening across the diaspora of America, and that we are ensuring that we're thinking about these challenges, these opportunities in our day-to-day work.
Okay. Well, Lisa, you also helped establish the Public Health Informatics and Technology Workforce Program back in 2021. Can you talk a little bit about this program and what is its overall mission and who benefits from it?
Absolutely. And first, let me just thank every member of the DIA Council within ONC for taking on the role that they have and being such key partners and players across the organization. As far as the FIT program, as we like to call it, the Public Health Informatics and Technology Program, when we created this program, it had three goals, which were to improve data collection in the public health sector, to strengthen the public health infrastructure, and to increase the representation of those impacted by public health policies and decisions, including those in underserved communities. And when we started the program, what we did was we looked across all of the different universities that offer training in public health and informatics. And what we saw is that there was a disparity. That minority serving institutions were not offering these types of courses and were really underrepresented across the country. And so what we wanted to do was both create an infrastructure in minority serving institutions to be able to provide certifications, associates, bachelor's, and master's degrees in public health, in informatics, and in public health informatics and technology as a career field. And so we worked to create this program with the administration and the White House directly, as well as, of course, Congress through the American Rescue Plan Act that provided funding for workforce programs. And so we're very thankful to all of our government partners. And we stood this program up and made 10 awards to 10 universities who are now training over 5,000 students and offering degrees at universities that, quite honestly, are not typically represented in any of those fields.
Wow, that is wonderful. You said you stood up 10 awards to 10 different universities.
We did. We did $75 million to 10 universities across 4 years to train over 5,000 students.
Oh, wow. Well, congratulations. That is amazing. Lisa, what progress has been made with the FIT Workforce Development Program since its launch? And how successful has it been when it comes to increasing diversity within the health IT industry?
It really is quite amazing what we've achieved so far. We've achieved more than half of our goal already, which is exciting. We have over 2,500 students that have been trained. The universities are up and running with their degree programs as well as certification programs. Are seeing that the universities are creating curricula and building these courses into their ongoing offerings. So the sustainability aspect of the program is taking hold. And I've had the opportunity to travel to a number of the universities and meet a number of the students. And what I am seeing is that these students are excited about the opportunity to have this career path and are already reaching back to their communities and the communities that they are representing to ensure that there's a trust and an understanding of public health policies and informatics, the use of the data, how the data can change how healthcare is delivered, and how policies are developed overall. And so we're already seeing a huge impact from the program and a huge excitement around it.
Wow, that's great. Well, Lisa, before I let you go, I wanted to know, are there any future health IT initiatives that you're excited to talk about?
Absolutely. I continue to be excited about the FIT program. We are going to achieve our goals and we're going to change the delivery of public health information and technology and make sure that all voices are heard in our policies moving forward. But I'm also very excited about the work that we are doing for health equity by design. Health equity by design really speaks to the fact that you have to start at the beginning thinking about culturally competent care. It's not something that you can back into, that at the design and the onset of your programs, of your IT development, of any efforts that are going to impact patients, you have to think about that at the onset and throughout your process. So culturally competent care starts at the very beginning with the design of the policies, the design of the programs, the design of the technology, the gathering of necessary data and the use of that data. And another thing that I'm really excited about, which is part of our health equity by design efforts, is our US CDI work. Our version 2, we started capturing social determinants of health data. In version 3, we are capturing race, ethnicity, and language data and are super excited to continue to push the envelope in regard to making sure that people are thinking about diversity, equity, inclusion, accessibility, and belonging in everything that we do.
Okay, that is amazing. Amazing to hear and just such good things because it's so true. You have to have everybody should have an opportunity at fair healthcare and everybody should have an opportunity to pursue those careers, no matter what your race, gender. So, before we conclude, Lisa, I do want to know if you have any final comments or remarks that you would like to leave with our listeners.
I just would like to say thank you to all of our federal partners. Thank you to all of our stakeholders who continue to engage in health information technology to ensure that information is accessible to all. Information is the great equalizer, in my opinion, which is why I went into IT as a career field early in my career, before a lot of women, and especially a lot of women of color, were in the IT field. I was building systems. And the reason is because if information can flow to where it's needed, when it's needed, and people have access to that information, they can make informed decisions. And so I just want to thank all of our partners for continuing to help us push the dial forward and to ensure that healthcare is delivered in an equitable fashion to all Americans. And so I thank you, Nikki, for the opportunity to be here and for your interest in our work.
Wow, that was awesome, Lisa. Thank you. I really enjoyed talking with you, and I appreciate you highlighting the DIA Council and the FIT program because these efforts are really critical to advancing health equity and increasing minority involvement in health IT. So thank you so much for speaking with me, and I hope that you have a wonderful rest of your day.
Thank you. You as well.
Thank you, Nikki. That was a terrific conversation with Lisa Lewis-Person. Before we wrap up our discussion, do you have any last highlights or takeaways that you want to leave our listeners with?
Promoting diversity and advancing health equity, I think will continue to be top priorities for ONC. Like Lisa said, the DEIA Council and the FIT program are opening doors and offering opportunities for more minorities to be involved in healthcare. And the work ONC is doing with Health Equity by Design is just amazing. It's focusing on the culturally competent care and the health data, which will have major impacts on patients that they will reap many benefits from, not just today, but also in the future.
Well, I'm excited to keep up with both Lisa Lewis-Person and the ONC in general to see what they're up to going forward. Well, thank you again, Nikki. Listeners can tune in next week for a brand new podcast in our GovCIO Media and Research podcast feed. But in the meantime, if you're not subscribed, make sure that you do that so you don't miss a single episode. Leave a review and a 5-star rating as well. And hey, tell a friend. We always appreciate growing our audience. I'm Alexander Bolova.
And I'm Nikki Henderson.
Thank you for listening. Healthcast, along with GovCast and Cybercast, is a production of GovCIO Media and Research. To explore our content, visit our website, govciomedia.com. Keep an eye out for new episodes every Tuesday. And if you like what you heard, leave us a review on the podcast platform of your choice. Have a topic you want us to discuss? Contact us at newsletter@govcio.com.